Hi, my name is Catalina Miranda, and I did my technological tool in virtual reality simulation. What is virtual reality? Virtual reality is a variety of immersive, highly visual 3D characteristics to replicate real-life situations and/or healthcare procedures. It offers an immersive platform for sharing theoretical and clinical knowledge. The literature indicates that it improves skill proficiency and learning outcomes among nursing students. Here's a short video that explains how virtual reality is being used in nursing education. So as you can see, virtual reality kind of magnifies and improves the way that we are changing nursing education, so that it's individualized for each student. The purpose of virtual reality in nursing education is to provide a safe, immersive practice environment, much like simulation, but in a different way because it's individual to the person who's wearing the equipment. It provides the opportunity to acquire clinical and psychomotor skills. It engages in clinical judgment and decision making by being a platform that delivers lectures and asks questions. It enhances engagement and retention. It stimulates interprofessional collaboration. It provides accessible training, and it provides debriefing practice and feedback. Expectations met basically is that we that as a society we practice safer care. Students are exposed to rare or high risk cases, and they have tech savvy training. Unmet, it could be that it could have cost and access barriers. By the profession, it builds judgment, confidence, standardized skills development, but it's also limited in tactile realism and less human interaction. Um, it's accredited by most learning competency-based. It counts towards simulation hours, but it's not universally accepted as clinical hour replacements. It engages digital learners, reduces anxiety, and gives consistent experiences. However, some students may feel motion sickness or have accessibility issues. And then cultural competence, platform can diverse patients and communication scenarios, but it can be often oversimplified and lacks depth in systemic inequities. Student learning and domains, it covers the cognitive domain, the psychomotor domain, and the affective domain. The cognitive domain, it provides feedback and instructing students what they can improve on. It also caters to different types of learners. It promotes knowledge retention and clinical reasoning. It for psychomotor domain, virtual reality improves student clinical skills such as IV insertion, urinary cath, BLS, or CPR. It can also has proved to be effective in nurse skill acquisition teaching like chemo, competence training, and phlebotomy. And then in the affective domain, it increases confidence by providing a safe space for trial and error. The concept of empathy is multidimensional and it involves emotional and cognitive responses from the nurse. So it enhances the nurse's ability to sense another person's feelings, become aware of the significance, and react accordingly. Specific learning outcomes. The student will show improved clinical reasoning and decision making. The student will demonstrate knowledge retention by recalling theoretical concepts and the application to practice. The student will develop situational awareness by recognizing subtle patient cues and anticipate complications. The student will gain competence with virtual reality that translates into gains performance in clinical labs and hospital settings. The student will demonstrate enhanced practical skills in IV insertion, urinary cath, CPR, BLS, chemo administration, and phlebotomy. The student will report reduced anxiety and greater confidence in patient care. The student will demonstrate the multi-dimensions of empathy by fostering therapeutic communication, and the student will demonstrate learning satisfaction and motivation by engaging in virtual reality training. Implementation of virtual reality in the classroom setting. Students apply theoretical knowledge in simulated patient scenarios. Virtual reality provides flexible learning opportunities, allowing learners to practice clinical procedures repeatedly without the limitations of physical resources or patient availability. The system review uses various levels of immersive virtual reality, resulting in higher results for cognitive skills than with traditional simulation. In clinical settings with virtual reality, facilitate student learning by successfully improving positive interprofessional attitudes of graduate students towards palliative care. There's a study that it was conducted, and it also demonstrated that nursing students who learned newborn assessments in virtual reality had better knowledge retention than those trained in face-to-face environments. Professional nursing expectations are the American Nurse Credentialing Center, the domains and the concepts, and then, of course, the Board of Nursing of Florida. So it's society expectations. Society wants us to provide safe, competent care. Virtual reality prepares students to manage emergencies and complex cases before encountering them in real life. Compassionate and person-centered care. Virtual reality exposes students to diverse patient populations and scenarios. We would have practice-ready nurses. Virtual reality accelerates readiness by providing exposure to rare or resource-limited scenarios that they may not encounter during clinical rotation. And professionalism and ethical behavior. Virtual reality exposes students to collaborate with other health team members and prepare them for ethical situations. Ways expected outcomes are intended for targeted population. The expectation goes with the cognitive psychomotor domain and affective domain. And the outcome basically is to have better prepared nurses that, even though they haven't gone through it in real life, they have experienced it with virtual reality, and they will be more prepared when they hit, when they get a job and they hit the floor and now they have 4 and 5 patients and they have to manage them and there's a million other things going on and they have to get through the shift. The specific target population, of course, is learning students. It targets the millennials and the Gen Zs. They are very digital natives. They're comfortable with immersive technology. They like it more than face-to-face interactions. Learning styles is another way that it could be measured. There's the visual learners, the kinesthetic learners, and the auditory learners. And virtual reality touches on each one. Computer literacy outcomes such as self-directed learning and adaptability are enhanced because students can navigate virtual reality platforms with minimal instructions. And then the employers, they want a workforce that's already ready. Though everybody does get trained to a floor, sometimes due to short staff, they have to pull orientees off orientation early. And like this, new graduates would already at least be exposed to a lot of different things as opposed to learning on the go. The learning theory that I chose was the experimental learning theory by Kolb. Virtual reality places students in lifelike patient care scenarios that reflect the complexity of real-world practice. It provides safe, immersive practice opportunities, and it enables repetition skills without added cost and effectively bridges theory with practice. It has research evidence. Studies highlight that the integration of experimental learning into online education to strengthen skills and competencies that connect practical experience with communication technologies. And there's learning opportunities. Virtual reality allows learners to freely explore, experience, and examine their environments. Students develop an understanding by interpreting observations, engagement in problem solving, and participating in coordinated collaborative activities. So areas that I would advocate to facilitate virtual reality simulations would be, for example, in clinical and educational settings, simulation labs, like I stated before, having students care for 4 to 7 patients with a variety of different diagnoses, different medications, different social problems while providing safe patient care. It's usually what med-surg nurses end up getting 4 to 7 patients. And the biggest complaint from new grad nurses is how hard their 12-hour shift is because they were not ready to take care of 4 to 7 different people with everything involved. In clinical sites, I would advocate for end-of-life care, honoring DNR or A&D patients, and postmortem care and being there for the family. Most of the time when a patient dies, it's the first time that the nurse ever does any of this. Whether the patient was DNR or A&D, or the patient wasn't, they still have to navigate end-of-life care. And most of the time they're already attached to the patient, but having a virtual reality simulation where they go through it, I think will help them out in their career. And then specialized areas, ICU setting simulations of a highly contagious virus. I mean, we kind of all lived through the pandemic, but the pandemic also showed us how unprepared we were for that. Mental health nursing, practicing de-escalation, therapeutic communication, and crisis intervention. It's not just in mental health. Practicing de-escalation can happen in any hospital. I work in a pediatric hospital, and we always have code bears or code strongs on other units. So I think a nursing student who is ready and already knows kind of what to do will be more prepared if the situation arises. And then in community health, stimulating a disaster response for stimulating a fentanyl overdose and what to do. A disaster response, it's inevitable. It can happen at any moment. And then right now we do have a fentanyl crisis and a lot of people are overdosing fentanyl. So something like that, and preparing students of what can basically walk through the door or not, and what to do about it. Of course, the faculty would have to learn virtual reality and how to be a facilitator to students. Faculty would have to learn virtual reality foundations, how virtual reality can support student outcomes, of course, technical skills, learning how to set up a scenario, troubleshooting, maintaining equipment, facilitation and evaluation methods, pre and post-conference assessment and skills, and of course, professional attitudes, open to new technologies, confidence in facilitating, and having cultural competence and reflective practice. The change theory approach for faculty to start using virtual reality. I chose the Lowens change theory. Faculty adoption of virtual reality can be guided through 3 stages. Unfreeze, build awareness of virtual reality's benefits, safe practice, immersive realism, cultural competence, and address barriers such as cost or technical skills. Change, provide training, pilot virtual reality scenarios in select courses, and encourage collaboration in designing diverse patient simulations. And refreeze, embedded virtual reality into curriculum and accreditation processes, celebrate faculty success, and ensure ongoing support and updates. The outcome would be the structured approach enhances faculty readiness, integrates virtual reality into teaching and evaluation, and ensures nursing students gain the knowledge, skills, and cultural competence needed to meet the needs of diverse patients and communities. These are my references for my project. Thank you.